So let's take a look at which industries saw the biggest technological shifts over the past 12 months. So first of all, we saw a change in online health services. So you can see some examples here, such as Nivea Skin Guide, Push Doctor, NHS COVID-19 app. Last year we actually spoke about China a little bit and looked at their situation as they had just gone through a lockdown period, and we could look at that and analyze that and see what technological innovations were coming out of off the back of the pandemic in China as they came out of lockdown again, which was quite interesting. And we've actually seen those trends replicate some of them replicate in the West as well. And so this has been very interesting for us to see as software developers, and also in the products that we've seen, the demand that we've seen coming through as a company. So last year we talked about healthcare products that could have video consultations, for example, Jianxing Doctor in China, and that was an incredibly popular app during lockdown, and it had a massive boom, and that's continued as well. So people had adopted that method of interacting, and that has continued to some extent, although people are still going out and having face-to-face interactions more than they were before during the lockdown. And we've seen that trend come over to the West as well. So, apps like the NHS COVID-19 app, there was, you might have heard about the famous integration of Bluetooth low energy technology between iOS and Android. We were following that quite closely, which allowed the two different operating systems to be able to speak to each other to measure distance. So if you pass someone, that would alert you that you've been in the vicinity of someone who's potentially tested positive for COVID-19. You've also seen online doctor apps, and we've even built a few with video consultations. So it's taking that servicing completely remote and allowing people to give video consultations remotely, and allowing healthcare consultants as well to give verdicts remotely as well, and that's also given some rise to the likes of AR and VR as well, where doctors can actually be somewhere and analyze something remotely and give their advice. So it's prevented them from having to travel to specific locations, and also reducing some of the strain on things like the NHS. We've also seen beauty apps and web apps for the likes of Nivea or L'Oreal or Skin Doctor, and they provide personalized experiences that are AI driven, giving beauty recommendations for their exact skin type and concern. So again, that's something that's come off the back of people not being able to go out and go into stores where they might have seen a skin consultant, where they can do that on an app through an AI supported algorithm, and that allows them to get the right products for them